Hello everyone, this is Jed Shlackman. I'm a holistic counselor and spiritual energy healer. And in this video I would like to cover the topic of looking at borderline personality from a holistic perspective, or holistic perspectives, since it's not really just one singular perspective that we would be exploring. It's seeing it collectively from more than one viewpoint, more than one angle or perspective. To preface this exploration, I want to talk a little bit about how I look at our experience or journey of life here in the physical plane as a human being. As spiritual beings, we've come here to go through different types of experiences, different types of roles that we play, so that we can understand and master a variety of things, which include different archetypal roles and patterns, as well as different polarities, so that these can be more deeply understood and integrated, so that we can bring it all together and reclaim our wholeness, our balance, our sense of oneness and integrity. This is a very deep, complex process. It's quite challenging to go through the human experience. However, from a spiritual perspective, it's actually very rewarding and empowering. When we look at psychology and psychiatry, it's common to see things diagnosed, labels given to different patterns, different sets of symptoms or traits that may appear in people. The purpose of this discussion is not to pathologize, not to medicalize the way people are functioning, but to see it in a more holistic and systemic way, where we can understand how people are adapting, how they're adjusting to the world they live in their effort to meet different basic needs or desires. As we go through human life, we're going through a developmental process. We evolve through different stages. We work toward, ideally, a state of greater wholeness. Of course, as we go through life, we go through different stresses, different traumas, different forms of external influence or programming that shape the way we see life and the way we see ourselves. As a result of that, we often take on different, essentially, distortions into our being, different imbalances in our consciousness, in our perspective. And then life, in a sense, mirrors those back to us to give us opportunities to recognize how we're seeing and feeling about things, to bring us those opportunities to transform ourselves, to perhaps learn to see things in a different way, to no longer carry those distortions, those imbalances in our perspective or our way of reacting to the world around us. Sometimes things that seem adaptive and helpful, things that enable us to be accepted in our environment or to survive in whatever surroundings we may be living in, become things that are actually inhibiting us from reaching more of our potential or finding greater harmony within ourselves and with our spiritual source. I hope that that explanation gives us some context from which to look at the way different types of personalities are described or defined. There's always somewhat of a subjective means of identifying these things. When psychologists or psychiatrists give a label, there's a subjective aspect to that. They're observing different behaviors, different emotions, different patterns a person presents, and attempting to categorize it for the convenience of providing treatment and providing a description to other people about what they've observed. That process of diagnosing always has its limitations and drawbacks. It can sometimes interfere with one's ability to see each person as a unique individual, to see the unique treatment needs that may be present with a given client. And also, when a person is given a diagnosis, they have their own subjective reaction to that, their interpretation of it, the meaning that they themselves give to it, which could be either productive or counterproductive, depending on their level of understanding. So with all of that in mind, I'm going to look now at the conventional psychiatric manual description of what would be called borderline personality. This is seen as a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. And there's a list here of 9 different symptoms that may appear. So in a clinical context, if a person exhibited 5 or more of these and those symptoms were interfering with their ability to function in key aspects of life, then the clinician might give a diagnosis. So let's go through these different symptomatic patterns that are described. Number 1, frantic efforts to avoid real or imagined abandonment. Number 2, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. 3, identity disturbance, markedly and persistently unstable self-image or sense of self. Number 4, impulsivity in at least 2 areas that are potentially self-damaging. For example, spending, sex, substance abuse, reckless driving, binge eating. Number 5, recurrent suicidal behavior, gestures, or threats, or self-mutilating behaviors. Number 6, affective instability due to a marked reactivity of mood, such as intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. Number 7, chronic feelings of emptiness. Number 8, inappropriate, intense anger or difficulty controlling anger. And number 9, transient stress-related paranoid ideation or severe dissociative symptoms. The essential feature of borderline personality disorder is a pervasive pattern of instability or interpersonal relationships, self-image and affects, and marked impulsivity that begins by early adulthood and is present in a variety of contexts. So to sum up there, that is what the diagnostic and statistical manual used by psychiatrists and other mental health professionals provides as a description for diagnosing borderline personality. If we kind of take a step back here and look at what personality is, we can see that we all have different traits or characteristics in our personalities, how we relate to other people in the world around us. In a sense, we all have imbalances in our being. We all may go somewhat to one extreme or another in how we approach different situations or circumstances in life. When someone is labeled with a disorder, it's usually where those patterns of imbalance appear to be at such an extreme level that they're creating a great deal of difficulty, a great deal of dysfunction in that person's life or ability to function in society. Even that is somewhat subjective, since if our society in general is dysfunctional, if our society itself is very imbalanced, very unhealthy, then how are we able to determine when a person is not conforming or fitting in that the issue is with the person versus the issue with their social environment or society itself? This is another thing to consider. Meanwhile, looking back at this particular pattern of personality, let's consider the possibility that those patterns of functioning or those adaptations may have been useful for that individual in adjusting to or compensating for what they've experienced at these different early stages of their life. Think of abandonment. When we're abandoned, there's a very painful feeling that comes with that, and we would wish to avoid having that experience again. So how might we cope with that? Well, when there's an opportunity for an attachment, an emotional connection, we may try very hard to grab onto it, to cling to it, or we may instead seek to run away from that, to avoid or reject the other person before they have the chance to abandon us. In a sense, to proactively create that abandonment from our end of the relationship rather than allowing for the possibility of the other person abandoning us. So those are two different extreme reactions that could come about from a desire to avoid abandonment. If a person has an unstable sense of self, if they don't feel content and secure within their own being and have this strong need or desire for validation from others, then they're very sensitive to how other people are acting or reacting within a relationship. They'll tend to take things personally rather than being more content within themselves and not being as sensitive or reactive to what they perceive with other people. Looking at this particular personality defense pattern, I'm going to compare it to something that's presented from a core energetic or bioenergetic perspective in the writings and teachings presented by Barbara Brennan. Barbara Brennan is the author of 3 popular books that relate to energy healing and what you might refer to as spiritual psychology. In Brennan's work, she applies a system that identifies different core personality structures and what you might look at as defensive patterns that they represent. There are 5 basic types that she identifies, which are the schizoid, the oral, the psychopathic, the masochistic, and the rigid personality structures. If we were to look at those and compare them to the symptoms that are described with a borderline personality, we'll find that there's a lot of overlap with what Brennan describes as an oral personality type. So I'm going to go through what she describes in relation to that type within that system so that we can kind of get a sense of how these overlap. So for the oral personality defense structure, she identifies their main issue as nurturance. So on a core level, this person would be looking to receive nurturance. Their deep fear is not enough of anything. So not having enough nurturance, being not supported, not fulfilled in that way. What they've experienced typically from this perspective is a lack of nurturance or abandonment. This is something that would usually occur at a very young age, from the time of birth up into childhood, perhaps even through adolescence. Those are the environmental circumstances the person experiences. Now, we have to realize that every one of us gives a somewhat subjective interpretation or meaning to our experience. So what seems lacking in nurturing to one person might not seem as lacking and nurturing to another person. So it's not absolutely what the environment is, it's the combination of the environment with that individual's perception of their environment, how they interpret and give meaning to what they experience in their environment. Now, the next part here is the defensive action. In other words, in order to defend or protect this person's self, what action do they take in a way to compensate for what they feel they've experienced? In the case of this oral personality type, what they do is they are sucking life. And what I interpret this to mean is that this person is looking for some type of external fulfillment, something outside of themselves to nurture them, to help them feel appreciated, validated, to help them feel, in a sense, alive and excited about being here in this physical experience. So they're seeking someone or something outside of themselves to fill themselves. That's why it's called sucking. So they're sucking on that external nurturance, wherever they might find it. Results of that defensive action in this model are an inability to metabolize one's own energy. So they've become so accustomed to seeking something from outside of themselves that they haven't really learned or mastered finding that security and fulfillment from within themselves. They haven't fully mastered finding that spiritual sustenance, that source of well-being that exists within. They're not content in that sense. They're always looking for that external fulfillment or source of nurturance. The relationship to their core essence that's presented here is that their experiences the person experiences their integrated essence as not enough. It's like a feeling of lack of worth or low self-esteem. They don't feel okay just within themselves. They need that external validation, that feedback from someone or something outside of themselves to make themselves feel good and valuable. The human level need identified here is to nurture the self, to know the self is enough. So as this person is working on their own self-healing, it's very important for that human aspect of their consciousness to feel okay with themselves, to not feel less than, to not feel that they're unworthy or that they're unvalued or unappreciated, but to feel confident and secure just by being themselves, not really needing to compare to others. when they compare themselves to others, there's a tendency to feel less than, to feel not enough. And that's just feeding into that negative self-image. So letting go of that tendency to compare oneself to others can be helpful so that they can focus more on just nurturing and validating themselves. Next, there's a spiritual need. The spiritual need for this oral personality type in Brennan's model is to experience the individuated essence as infinite source within. This is where the spiritual component is very important, to develop some type of spiritual practice where you're feeling, where you're experiencing that spiritual connection. In a sense, you're feeling yourself reunited with the divine, where you're no longer separate from that spiritual essence, and therefore you don't feel that God has abandoned you, has dropped you off in this harsh planet, this dense environment with uncaring people and so on. You understand that you are at one with that source. That source is always there, loving you, having compassion for you, understanding for you, wishing to share love with you, to send you energy and inspiration, to help you fulfill more of your deepest intention for this lifetime. Those who feel that lack of nurturance, who are very sensitive to what they perceive as a harsh environment, often have forgotten to embody that divine essence, to know themselves as part of that spiritual power. So tapping into that, reminding oneself that you are a unique expression of that divine creative power, that divine intelligence, helps rebuild your sense of self. It gives you a more balanced and healthy self-image. And then the next component of this model is what is referred to as a time distortion. So how does this individual perceive themselves in relation to the flow or passage of time? And for this oral character structure, there's a sense that there's never enough time. So that person may feel pressured to meet their needs within a certain time period. They may feel like time is running out to get the nurturance, the love they desire, to find their fulfillment in this life. These are all issues that can be addressed therapeutically. Part of this therapeutic process is helping that person develop a greater understanding and awareness of the why. Why are they functioning the way they are? Why are they reacting to things the way they are? Why do other people react to them the way other people react to them? What are those deep unmet emotional needs that are driving their reactions, their behaviors, their perception of life? It's frequently very important to heal the child self, to deal with those emotional traumas, those very primal attachment issues that are unresolved. So using therapies that get to that core layer of the person's being, that really go to the origin of the development of that personality structure. When that person is able to reconnect with that child aspect of self, to help that child feel truly loved, truly valued and valuable, to have an inner contentment regardless of how they may have perceived the way other people were treating or reacting to them, then that can help them build more balance and stability help them be more centered and have a more clear, a more balanced understanding of the way other people are relating to them. It's very common for there to be some significant traumas that occurred early in that person's life. So using different forms of energy healing, body work, somatic therapies to release those traumas, also different forms of emotional or energetic psychology, regression therapies, shamanic, spiritual types of therapies to really reintegrate those aspects of the self, those soul fragments, we might call it, that have been, in a sense, stuck in those earlier stages of development. If we think of how a child is responding to their environment, it would make sense for a child to react and behave in certain ways. So children at a young age do tend to be very clingy to their parent, and at that stage of development, we perceive that as a natural process, a natural way of that child relating to the parent. At that particular stage, the child does need a lot of intense nurturing from their parent. They're not ready to function as an independent, individuated adult. So it's a natural need at that stage for the parent to be giving a lot of attention, to be giving very constant reassurance. So if a child is clinging to a parent, that would seem normal. Yet in an adult relationship, if we perceive that same level of clinging and attaching behavior, we might perceive it as problematic, as dysfunctional. So to resolve it, it would be helpful to help that person reconnect with that child self and help the child self receive the nurturance it needs in some other way than what was not provided at that young age, so that that issue can be released, so that kind of exaggerated need for nurturing can be healed, and thereby the person can function in a more balanced way in their adult relationships. That's just one example of an issue that might be addressed in order to help heal what has been identified as a borderline personality type. There can be different forms of abuse that have occurred. Sometimes it's physical abuse, sometimes it's emotional abuse, sometimes it's sexual abuse. So depending on those different forms of abuse, the person may develop different behaviors to help protect themselves, to help compensate in some way from their desire to avoid further pain or further suffering. In a sense, the solution is to actually go back to that part of the self that experienced the original pain and suffering and help it process that and release it so that it can come back to some type of a balance or equilibrium where it's no longer necessary to overcompensate, to develop some type of imbalanced approach to life, where it's okay to be more centered, to be fully present, to be open to each experience and each relationship without carrying the baggage from those other times, without carrying those reactive patterns. This is ultimately a process of spiritual integration, where all these different aspects of ourself, those parts of our being that have existed in different times and places, are all brought together into an integrated whole, where we can access the perspective of our higher self and use that level of understanding, that level of awareness in our everyday human interactions, so that we're not stuck in a very narrow or limited perspective, but that we're able to access more of that full spectrum of who we are, so that we're not stuck reacting to all of our relationships as a 5-year-old child, a 15-year-old adolescent, and so on, where we can deal with any particular situation or relationship in a way that's most constructive, that's most healthy for that particular relationship or situation. This means we need to be able to access that fullness of who we are. In order to do that, there's often a lot of healing work that needs to be approached or processed. Things that we have carried from the past that are still influencing and impacting us, that we can in some way shift or release once we're ready and willing to face and reprocess those experiences, once we're ready to understand how those past phenomena are impacting us in the present, how they have shaped our personality. We all have the power to evolve and transform. In fact, this is what we are doing all the time. Nothing is meant to be permanently static, to exist the way it is forever. Everything is in a process of evolution. And so we can consciously evolve. We can set an intention to access a greater potential, to become more in harmony with our higher self, rather than remaining stuck in those states or situations that we've carried from the past. This is something for all of us to consider, whatever labels we may have been given, whatever personality styles or types we may have identified within ourselves. There's always that opportunity to grow, to find greater balance and wholeness, to experience greater mastery of ourself and greater mastery of how we relate to the world around us, how we interact on a social, on a communal level. I hope that this discussion has given each of you some ideas and insights into yourself, into your relationships, perhaps into other people that you may interact with, so that you can have more understanding and compassion for yourself and others. Hopefully this also gives each of you this opportunity to see the potential that we all have to grow and evolve, to become healthier and happier, more secure and content within ourselves, more compassionate and understanding toward others. For those that are interested in exploring holistic healing topics even further, I invite you to watch more of my YouTube videos and also to visit my website at www.phinsights.com. That's PHINSIGHTS.com. For now, I want to wish everyone a wonderful day. Namaste.